Sure. All right.
So the, are you guys going to shift the camera so you can see the pack? Oh, there, it's not quite in view, but it will be.
Right there.
Yeah,
Shall I slide it or leave it right there?
so we're getting more and more people on board. So nice to see everybody. You're all muted, you know, you're muted to start with. Can you hear it, me? Can they hear you?
Yeah, well, we can hear you.
I can hear you.
Oh, good, good. They needed a sound check. Thanks. How about you? Everybody
hear
can
you.
hear? Okay,
Yep,
good,
I
good.
gotta unmute myself.
Yeah, and once they get started, every little background noise gets picked up, you know, in the rooms. So glad that you guys could take the time to be present. Here's Kristen, Dave, David, Dave.
Yes.
Hi, welcome.
Hi, how are you?
I'm good, good. Looking
Good.
forward to this presentation.
Yep, Wendy's sitting right here, so.
Oh, good, good.
Yep.
With their masks on, now I get to see what they look like.
was
I
hoping that
know, we
was
haven't
with
seen
Dave.
anybody. You're right. We get to see your face. How was class this week for everybody?
Thumbs up.
I mean, what choice do you have? You can.
There you go. Okay.
Exactly,
Okay.
on the board handle, yeah.
So, Bill, do you want me to keep track of who's there, or is somebody else doing that? Or do you even care? Oh, Bill's not in the room.
I don't care. We're gonna record it, Madeline, so anybody can watch if they want. Is she saying anything?
I am, I'm here. Do you? So the question is, do we start exactly on time or do we do it Hawaiian time?
It's your call.
Yeah.
Gentlemen.
You can say the time, Bill. Ready to go when you are.
I'm ready. Do you want to wait? for-
We'll use British time. How's that?
British time.
Is that prompt, Peter?
I think that's about 9 hours for us, maybe 8 or 9 hours.
What is it,
No, I-
3:30 where you are, Madeline?
4:30.
4:30?
Oh, you're in Hawaii.
Yeah.
Lucky person you. Why didn't we do this program from there?
Next year we could do that.
We'd have to take the audience with us. I can see. them.
Yes.
I'm ready to do the introductory thing if you want.
Let's go.
All right.
Well, welcome everybody to Bellingham Sail and Power Squadron, the Zoom workshop series. And tonight our topic is first aid for coastal waters put on by our own Dr. Peter Coggan. First, a little introduction to the film crew here tonight. We're getting sort of smoother at this, but there's still some glitches and we're having fun sorting them all out. My name is Graham Hunter, and tonight all I'm doing is standing here giving an introduction. Bill Moran, Squadron Education Officer, is the fellow responsible for hooking up all the wires, and helping him is Daryl Lynn, who's behind the camera. By the way, and Donna Hunter is giving assistance for, well, you'll see her in a few moments. So we're just really lucky in the squadron to have Peter with us. Peter Coggan has been an educational physician for the last part of his career in Seattle. And we're so lucky to have him with us as part of our teaching team and also as a resident physician. We have several actually in the squadron, which makes us really lucky. Peter tonight's going to be the one to talk about first aid for coastal boating. And that's all I'm going to say about Peter. We're going to let him introduce himself to you and take over the show from here. Thank you, Peter.
Well, thank you very much, Graham. And good evening, everybody. Thanks for joining us. We have an exciting about hour and 20 minutes from me, and then I'll try and leave some time at the end for questions so that we can answer those while the show is going on. And Bill, can you bring up the first slide for me?
And probably it would be important that everybody do mute their, press mute so we don't get background noises. Sorry to interfere.
I think we should be just there. All right. So everybody should have a copy of the slide deck. And there is only one comment about problems with it, and that is that towards the end, there's one duplicate slide. You have everything that I'm going to be talking about. I'm just going to warn you at the outset that we're going to be moving through the slides quite quickly. Some of them contain a whole lot of information, and I'm not necessarily going to go through everything that's on the slide. The whole idea here is to give you a slide deck that you will be able to keep, look for more detail at some time in the future if you need it, go over the whole thing if you wish to again, and if you have questions, call me or send me an email. So you'll see on the first slide is my name and my email address. And please feel free to email me after the presentation at any time. If you have any questions, I'll do my best to answer them. I do want to make sure that everybody understands that the slides are not entirely of my making. And 3 of the other physicians who are members of the Power Squadron contributed some slides for this presentation. So it's not all my own work. Now, right there. There's always time for a little humor, and I hope you like this slide. We're going to be talking about some very serious topics today, but here is one of my favorite slides. It says, blowing on the wine in the mug will help convince your Zoom meeting that your tea is hot. And if you can't understand what that means, you better email me after the presentation is over. The first section we're going to dive into is all about prevention. And of course, as in almost everything in life, prevention is better than a cure. So there are some things that you can do to prepare for the potential of medical problems on board in the hope that they will never happen, but will make you much better able to deal with them if they do. So first, carry a little pocket book on board in your library. The first aid kit that I'm going to show you in a few minutes has the book on the left as part of it. The other one on the right is commonly used. Either of those or both of them won't occupy much space on board, but please do get yourselves a short textbook so you can refer to it if you need to. Safety and prevention. Well, the first order of business here is get a vessel safety check. And the squadron here has a remarkable record of the numbers of vessel safety checks that we do. So make sure that you sign up at the beginning of the season to make sure that you have all of the equipment that is necessary on board to satisfy Coast Guard regulations, and that it all works. Second point, purchase and practice a man overboard drill. I don't know what you have on board, but whatever you have, make sure that it's there, it's in good repair, and that you have practiced using it so that you know what you're supposed to do. Keep and maintain a first aid kit on board. That's what we're going to be dealing with in just a few minutes, and I will open that discussion with an embarrassment. And that is that when I bought the boat that I have right now, there were 3 first aid kits on board. And I thought that that was pretty good. We were all ready to go. Several months later, I opened up some of those kits. One of them was almost empty. The rest, the other one contained some orange peel and I think some cherry pits. And the third one had pretty well nothing in it. So if you have first aid kits on board, make sure that they are fully equipped and ready to go just in case. Now, I'm a stickler about this, but the responsibility for all of this does not lie only on the captain. The crew and passengers are all involved in making sure that everyone is safe. So brief them ahead of time. Tell them that they have to wear their life vest when the boat is in transit. Everybody on board, no exceptions. And that they are all part of the lookout. So they've got to be aware of their surroundings at all times. And if they see something, say something. Getting out on deck, particularly for sailboats, use the handrails, use the safety lines, and be cautious. Take no risks. Don't go up there in bare feet. If you stub your toe, not only will it be an agonizing problem, but you run the risk of jumping overboard because of the pain. Know the man overboard drill and make sure that you discuss this with your guests so that they understand what they should do if anybody were to fall overboard. If the weather is rough, use jack lines and also protect yourselves from the sun. Stay hydrated, but not with alcohol or not with excess alcohol. And stow any items that may cause problems in rough weather. We have a rule on board that there is no glassware at all, no glass bottles, no glass of any kind. So you might institute that rule, because if it falls off the table and smashes on the floor and somebody treads on it, you're going to have a problem that you'll have to deal with. Health issues. We are often reluctant to talk about friends and guests about health issues. It seems intrusive, but you really do need to know if there is anybody on board who has a serious health issue that might cause problems. So discreetly, quietly, make sure you ask them. Next, CPR. I recommend that you take a CPR course. And if you have taken one several years ago, that you retake it, because the techniques do change over time. Again, it's one of those things that we hope that you never have to use, but we will be talking about some situations later in this presentation where CPR could be a lifesaver. So keep that in mind. And finally, one of the most important safety pieces of equipment on board is your VHF radio. So make sure that you know how to use it. Make sure that there's at least one other person on board who knows how to use it. And you can get this plastic card from the squadron and post it somewhere or have it easily available just in case everybody is in a state of high anxiety and they need a reminder on how to operate the radio and call for help. All right, change of tempo here. Let's talk about first aid kits. I was pretty scathing about what I found on my own boat. So finally, I went out and bought myself a proprietary first aid kit, which you can see here on the table next to me. There are many of these on the market, and I'm not particularly advocating for this one. I decided, looking through the contents, that this would meet my needs. Your needs may be different, and you just need to look through the contents that are in the kits that you're interested in purchasing and make sure that they have in them the kinds of things that you think you're going to need. This particular one is from Dan Boter, and it's Coast Guard approved. It cost me about $200. So these things can range anywhere from $100 to $800 or $900. I don't think you need a high-end first aid kit for just coastal cruising. So you don't need to go that high, that high up. But if you're thinking of blue water cruising, you will definitely need something more expensive, and you will also need a more comprehensive course than what we're offering today. Now, most of these kits have sections in them. So you can see on the left side here, that particular kit has a container of items that would be useful in wound care, bleeding, burns, some medications, fractures and sprains, and CPR instruments. The one that I have here on the table next to me has a slightly different division of the various items in the first aid kit, but it's quite similar, quite similar. So I'm going to go through some of the items that you might expect to find. And those items are usually classified under one of these 7 headings. It's nice to have them packed that way. And that is the reason why I am not going to unpack my first aid kit today, because the last time I did this, it took me over an hour to put it back together again. But just be aware of the fact that you will have some subsections in your first aid kit that are focused on certain specific emergencies. And you'll find contents kind of like this. You will probably find a large absorbent pad. Here it's called a trauma pad, or maybe a couple of them if it's a bigger kit. And those are for situations where you've got copious bleeding and you really need to apply pressure and absorb a large amount of blood. There'll be a number of different types of gauze. The typical one is the 4x4, but there'll also be other different sizes, and some of them may also be non-stick. We'll talk about that a little bit later. There'll be a selection of bandages. We have here elastic bandages, always good for keeping a dressing in place. A cohesive bandage that will stick to the skin, and self-adhering. And I'm going to show you an example of that a little bit later, so that if you're wrapping a limb with the bandage, it will sort of stick to itself. Beautiful stuff to deal with and fun. A pair of gloves, which you may never use. And honestly, let's talk about infection control on board. You'll be dealing mostly with minor stuff on board, minor injuries, lacerations, and so on. I don't think that you necessarily need to wear gloves unless you want to, but do wash your hands and wash them thoroughly, and do clean the wound up so that it's clean. But you really don't have to aim for operating room kind of sterility. It's just not practical or possible on a boat. Hand wipes, again, are for cleaning your own skin. The infectious control bag is probably not a bad idea. If you have one in your kit, use that for throwing away all of the gauze, sponges, and so on that have blood or other body fluids on them. Put them in that same bag and dispose of them without touching them again. Other things you may find: a syringe, which is not for injecting things, but it is for irrigating. So if you wanted to use some water to wash out a wound, if it's got some gravel or other foreign substances in it, you can wash that out. Wound closure strips, I'll show you an example of those a little bit later. And the tincture of benzoin is sort of an artificial skin. It dries on the skin and seals it. So you'll often find that as something that's in your kit. I don't know what an after cuts and scrapes wipe is. It's probably a wipe with some alcohol in it. Povidone iodine is that dark brown stuff that is often used in the operating room around a wound to make sure that the skin doesn't have any bacteria on it. Triple antibiotic ointments, that's self-explanatory, I think. And alcohol swabs, also self-explanatory, followed by a whole list of different kinds of dressings. You don't need all of those, but you do need a selection of some, just in case. There's a comprehensive list. There's more. An iPad, always useful to have. But again, I will show you something later that you can find typically on board and use if you don't have an iPad in your first aid kit. Also in this list here on this slide are a number of other things. Bandages, elastic tape, adhesive bandages, a tongue depressor, a fork handle or a spoon handle will work perfectly well, but they include one in this particular list. Cotton tip applicators. If you have ladies on board, they're bound to have some Q-tips, so they will do just fine. Moleskin is a sort of a soft material that you can put on some kinds of burns, and I think it's optional, but it's nice to have if your kit contains it. Again, gloves, hand wipes, and the infectious control bag. And finally, for fractures and sprains, sometimes your kit will have a splint in it, and this one does. To be honest with you, I don't think it's very effective, but it's in there. And it's a large one for an arm or a leg. It folds up, and because it folds, it's not entirely rigid. So I think that's one of the problems with it. They also have some finger splints in here, which look like popsicle sticks. Cold packs, very helpful. If you have a freezer section in your fridge on the boat, putting one of those in there at the beginning of your cruise will give you a cold pack if you ever need it. You can pull it right out of the freezer panel, and there it is. More bandages of different kinds. The infamous triangular bandage, which I will demonstrate to you later. And finally, a list of other things to do with blisters or burns. Aloe vera with lidocaine. I don't like that because lidocaine can sometimes produce a nasty skin reaction in itself. Aloe vera alone is good enough, I think. All of the rest of this list are different kinds of things, different kinds of dressings that you can use on burns, and we will talk about that a little later. CPR instruction, a long list of things here. My feeling about CPR is to do the minimal kind of CPR and do it as well as you possibly can. And don't bother too much about getting airways into your injured crew member, but just do basic CPR as well as you possibly can, with a possible exception of something that is not on this list. And if your kit has an ambu bag, that may allow you to hold it over the nose and mouth and push air into the patient. But otherwise, I would just rely straight on chest compression. This list of medications is pretty much standard. I'm not going to go through it in any detail. It contains analgesics for pain. It contains antihistamines for either seasickness or allergies. It's got your antacids in case you have heartburn or diarrhea treatments, if that is a problem. Laxatives if you get constipated. Whoops, excuse me. Cortisone creams, always useful. An eye wash, again, always useful, but there are other ways to deal with that. And I've never encountered jellyfish stings up here. Maybe that's more appropriate for tropical climes, but I really wouldn't worry about it too much. All right. So what about special equipment? I've had this question come up before. Should we carry a defibrillator on board? And my answer, now this is just me, you have to understand, is no, don't carry a defibrillator on board unless you have somebody who you know has had cardiac problems and might need you to use one. Why do I think that? Well, first of all, it's a very expensive piece of equipment. Secondly, if you don't use it the right way, you can do some serious harm to yourself or anybody else who is around the patient. So you have to know how to use it. And I think the risk-benefit equation for most coastal cruising around here says, don't do this unless you have someone who has a heart problem that you know about and they're going to be a frequent guest on your boat. I feel the same way about EpiPens. EpiPens are epinephrine injections used for individuals who have severe allergies. And those severe allergies may be so severe that they get hives and also swelling in the throat so that they can't breathe. So that people who have this kind of problem can in fact die. And an EpiPen can be life-saving. Usually, individuals with that kind of problem will carry their own EpiPen, and that quiet discussion with them before you set off will tell you whether they have it with them or not and where it is, just in case you need to use it. But I don't recommend carrying one on board as a kind of a routine, A, because it's very expensive, and B, because you're probably not going to have anyone on board who's going to need it. IV fluids for coastal cruises. Some people like to carry some saline, normal saline on board with IV needles and so on. I don't think that's necessary. If you were going offshore, by all means, but not for coastal cruising. Tracheotomy set, unless you know what you're doing, I don't advise it. Again, if you're going blue water cruising, you might want to have one on board, but honestly, you really need to know what you're doing to be able to use that properly. And I feel the same way about the chest needle set. If you had someone with a tension pneumothorax, that is a condition where there is a chest injury, but there's a laceration in the surface of the lung, which allows the air to leave the lung and enter the lung cavity, building up tension and making the lung smaller and smaller and smaller. I hope that makes sense to you. And you can cure that by sticking a needle in the chest. You can hear the air. You can hear the air exit through the needle, and it can be a lifesaver. But you're not going to encounter that unless you're very, very unlucky. And if you stick the needle in the wrong place, you can really do some harm. So I don't recommend it. You may feel differently. You may have special skills. So if that is the case, by all means, but that's my recommendation. Okay, another change of pace. How are we doing on time, folks? You all right? Okay, All right, we're doing great. Common minor medical problems. Now, when I say minor, I mean those that can be handled pretty satisfactorily on board without any external help. So this is not the kind of situation where you would be heading for the nearest hospital on your cruise, or where you would be radioing the Coast Guard for help. We're talking about more minor stuff than that. And that's the bulk of what you're going to have to deal with. So cuts, abrasions, and burns. The key here is expressed here in the 4 C's, what I call the 4 C's. First of all, clean the wound. If you've got a slice finger from a knife slipping, or if you've torn your skin on a piece of the rigging, if you fell and skinned your knee, or if you just touched a hot stove and burned a fingertip, this is the kind of situation I'm talking about. Clean it up first, and you can use tap water. And now you may think, well, I don't know what's in the water in my tanks on my boat. The water's been in there for some time. There could be all kinds of bacteria there. And that's true. But the kind of bacteria that you have in the water on board is unlikely to cause a serious infection. And the practical thing to do is to use the material that you have available on your boat. And in my opinion, water running through one of your faucets is perfectly fine. If you want to be a little bit more medical than that, alcohol wipes, peroxide can be used, and you will certainly find alcohol wipes in your first aid kit, and you may have a little bottle of peroxide as well. But clean up the cut or the abrasion. You could use bottled water, sure, but tap water is just fine. Once you've cleaned it up, dry it off and cover it. Cover it with a Band-Aid, if it's that small, with gauze or with some kind of a non-stick dressing. And I will show you one of those in a few minutes. If it's a laceration that is jagged, or a knife cut that is open, you can put a dressing on it that will close it up so that the cut edges are together. And then you can put a bandage on the top of that. I'll show you one of those later. Compression is really helpful, particularly if you have continuing bleeding. You don't want to make it too tight, so this is a judgment question, but apply a bandage that will apply gentle compression to the damaged area, and cover it with another bandage again to give you just a little bit of compression to stop the bleeding and stop the swelling. And then the final C is change the dressing. Not every day, not after the first hour or two, unless you can see blood coming through, but change it occasionally and take a really good look at the wound and make sure that it looks like it's healing in a healthy way. So those are the 4 C's for cuts, abrasions, and burns. I'm going to give you a demonstration of one of those dressings a little later. And here's a nice mnemonic for you to remember. Burns. 3rd degree and 4th degree burns are very serious. And you need to get to a hospital as quickly as you can to get treatment for those. 1st and 2nd degree can usually be dealt with on board. And we just talked about that a little bit. The 1st degree burn, and you'll see that in the inset, the photograph, little thumbnail on the left-hand side. You'll see somebody who's got a scald or a small burn. You want to cover that up with a non-stick dressing of some kind. either one of those with a plastic surface on that I will show you, or my own favorite, paraffin gauze. And then put a gauze dressing around it, leave it alone, and usually those will heal very well. So that would apply to the picture on the left, and also the one to the right of it, which has a finger that looks like it touched the stove. It's got a really red spot around one knuckle, and maybe even a little bit of blistering, which would make it by definition a second-degree burn. Don't pop the blister, just clean it up, put a non-stick dressing on it, a little bit of pressure, and leave it alone, and it's going to heal up perfectly fine. Just to emphasize one more time, if you see that the burn is more extensive or deeper than either of those two, so that they would qualify as either a third or a fourth degree burn, this is an urgent emergency situation, and you need to head for the nearest hospital, maybe call the Coast Guard and ask for their advice on where to go. But that patient needs to be seen by professionals in a clinic or a hospital. Okay, minor burns. We already covered this. Cool water over the affected area. Don't break the blisters. Moisturize. Aloe vera you might want to use. Non-stick or paraffin gauze. Keep the burned person out of sunlight. If you get warm sunlight on a burned area, it can be really painful. And you might want to give them something for pain. I forgot to mention that previously, but ibuprofen or acetaminophen would be good examples. Okay, bumps, bruises, strains, and sprains, common on boats. You know, we all bump into things, jump down off the deck and twist an ankle or whatever it happens to be. And here, analgesia is going to be necessary. Ibuprofen, which is Motrin, and acetaminophen, which is Tylenol. In general, I don't recommend aspirin because in some people it can really tear up your stomach. So I prefer either ibuprofen or acetaminophen. Cold packs. Remember, we talked about retrieving one of those from the freezer section in your fridge. Wrap it in a towel. Don't apply it directly to the injured area, but wrap it in a towel and leave it on there for 20 minutes or so. And why cold? Well, because it's very effective in reducing the amount of swelling. And it's the swelling that will often cause a lot of discomfort. So that's why cold is recommended first. And later on, for comfort and relief of muscle spasm, warm packs may also be helpful, but start off with cold. Try to elevate the injured limb just above the horizontal, again, to reduce the swelling. Immobilize with a splint or a sling, which I'll demonstrate to you, or an elastic bandage, which I will also demonstrate to you. And then gradual progressive rehab back to normal function. And for most bumps, bruises, strains, and sprains, you're going to be able to deal with that perfectly satisfactorily on board. If things are not progressing pretty well over a 2 or 3 day period, you may want to have your crew member checked out, but mostly everything's going to recover just fine. The footnote down at the bottom just reminds you and me that if the skin's broken, obviously, you deal with the laceration or the abrasion first, and then you go into the treatment pattern for the bumps and bruises. So if you suspect somebody of having a minor fracture, and I put minor in quotes because it's sometimes difficult to tell. If you see that a limb is deformed because somebody has fallen on an outstretched hand, or tripped over and really hit their thigh on some part of the boat, and the leg is hanging at a strange angle, that by definition is much more serious, and you should not be treating that on board, other than stabilizing it and getting ready to get your crew member to a hospital or a clinic. So if you think that you ought to be straightening a fractured limb, by definition, you're dealing with something that's not minor. So stabilize, get the patient comfortable, give them something for the pain, and head for the hospital. We'll talk about splints a little bit, and I'll show you an example of one later, how you can put one of those on to stabilize an area, keep it from moving. Apply a cold pack. Don't apply it directly to the skin, as we said before, but wrap it up first. Keep the area elevated if you possibly can, and give either ibuprofen or acetaminophen to deal with the pain. If it's a broken bone, that's probably not going to make all that much difference, but it may help a little bit, so worth a try. Okay, so we've been through some minor injury situations, and this is where we turn to that TV program that we all loved when we were kids, MacGyver. You have a lot of stuff on board that can be called on for use in a medical emergency, and you might never have thought about using it. But I encourage you to work through this list. This comes out of Practical Sailor, the magazine. Incidentally, my partner Maureen says that's an oxymoron. There's no such thing as a practical sailor, but that's her bias. Battens from sails can make ideal arm or leg splints, and so can a rolled magazine, especially if you fasten it snugly with duct tape. Now, none of those are medical things, right? But it's just using the materials that you have on board. Popsicle sticks make good finger splints. A towel, you can cut a towel. You don't like to do that, but if you have to, you can cut a towel to make a triangular bandage and make it into a sling. Rolled towels, if you want to stabilize someone with a neck injury before they are moved onto an ambulance, you can roll up towels and put them either side of the neck to prevent your crew member from moving the head too much. A belt, I have an example on the table. I'll show you that, but a belt can be a great tourniquet, as can a sail tie. We used to call them gaskets, when you lower the main, tie it up, keep it nice and tidy. One of those would be good as a tourniquet, and something that's flat, like a piece of webbing, often works better than a round line of some kind, simply because it's a flat surface and it's less likely to dig into the skin. Oh, and here's one of my favorites, a paper cup. So you can cut off the bottom of a paper cup and put it over an injured eye and tape it in place and provide your crew member with a whole lot of comfort, because the eye is in the dark, it's not irritated by light, and it also isn't going to get any damaged any further. So that's a nice temporary thing that you can use while you're shipping your crew member to a hospital or a clinic. The sail, I hate to see this because sails are so darn expensive, but you can wrap someone in a sail if they happen to be suffering from hypothermia. You can also take further down this list your aluminum foil out of your kitchen equipment and use that. It is very effective in reflecting the patient's, the crew member's own warmth back into their body and prevents them from losing heat. And I'll show you a more expensive example of that later, but the principle is much the same. It's reflecting the heat back into the patient themselves. Baseball cap, if you can fold that correctly, it can make a nice cervical collar for somebody with a neck injury, but so can also a towel. If you roll up a towel nice and thick, that also can produce a nice cervical collar. Clear plastic wrap can cover a sucking chest wound. My goodness me, I hope you never see this, but here, the author here is recommending that you tape it on 3 sides so that when the patient is breathing out and the air comes out of the hole in the chest, it has somewhere to escape. But of course, when the patient is moving in, is breathing in, and there's a tendency to suck air in from the outside, the plastic wrap will then form a valve and stop it from doing so. I think this is just here for everybody's interest, and I hope you never encounter that kind of situation. Clear plastic bag can shroud an injured hand or foot. Fresh water can be used to flush wounds. Turkey baster makes a wonderful syringe for irrigating a laceration. Bunk sheets can be folded. Napkins can be cut into small wound dressings. Plastic credit card to brush off a bee sting or a nettle sting. And this next one, I do not recommend that you try at home. Using a cockpit winch and the length of webbing to reduce a fracture before you actually splint it and presumably head for the hospital. This might be the kind of thing that you want to think about if you're in the middle of the Pacific Ocean, but I do not recommend it for coastal cruising. Sanitary napkins like Kotex, you might not think of that, particularly us guys, but that can be very useful to absorb blood or any other body fluids that are leaking from a wound. And tampons can be very effective for a nosebleed if you can't get that stopped. Tea bags will sop up blood, and there's something in the tannin in a tea bag that will also tend to stop the bleeding. Fresh oranges, good source of vitamin C in case you're dealing with someone on board who's having a diabetic reaction of some kind, hypoglycemia. And then rum. I know you're going to hate to do this, but you can use rum as a cleanser and as a painkiller and an anesthetic. And here I'm talking about using it on the injured person, not on the person who is administering the treatment. So just to make that clear. All right, so we're going to move to another table, and I'm going to give you a series of demonstrations on some of the things we've already talked about. So here, what I have is my open first aid kit, and on the table, I have laid out some of the equipment that I have in here, and also some other things that I have discovered on board that will really help me to deal with some of the situations we've talked about. So, first thing I want to show you, this bandage, which is a real favorite of mine. This is a HydroSeal bandage, Band-Aid, that is specifically manufactured for heel blisters, but it is excellent for small cuts and abrasions and small burns, and I will show you why. So when you open these things up, course, I'm not using sterile technique here. What you find inside is this, which has the usual kind of bandage arrangement. So there are two little bits of paper on one side that you can pull off to get to the sticky side of the bandage. And the sticky side is the whole of the bandage. But you'll see on this example here, there's a deeper yellow, or orange yellow section right in the middle. That is colloid, and it contains A, an antibacterial, and B, something that will absorb any blood that is still coming out of the wound. And these things stick like crazy. You can leave them on for 3 or 4 days, and as long as you're not really abusing them, they'll still be in good shape. And they will still be protecting the wound, whatever it happens to be. So suppose you had a burned tip of your finger. You can just put this over the burn once you've cleaned it up and twist it around. And there you have a waterproof dressing that will not allow any air to get into the injured finger. It contains an antibacterial element, and it's got some flexibility in it. So you're still working the boat, and you can wear one of these things and do everything that you need to do. And they really are quite difficult to get off. So, what are my favorites? Very good for small injuries. I recommend them. And here's one other thing. This is a butterfly wound closure. And these came in my kit. Maybe not. I'm reluctant. Here we are. So I hope you can see this. Kind of bandage that you get has 2 big ends and a kind of an isthmus in the middle. Okay, and the idea here is that you stick one side on one side of the wound and then pull slightly to close the wound and then stick the other side on. So it's called a butterfly bandage. And it's used to make sure that an incision, a laceration is closed, and that promotes healing. It promotes healing if you close the wound up for 2 reasons. First of all, it closes it off to bacteria, they can't get in. And secondly, and more importantly, it stops the edges of the wound from getting dehydrated and drying. So that kind of closure can be very useful. I actually prefer this. This is a Steri-Strip. I don't think this is going to show up very well, but let's give it a try. So what you see here is a piece of card which has some strips running down it. Graham, can you see that on what you're looking at? You got it, okay. So you can cut these to the length that you want, like that, if it's a small laceration. And because of this fold in the middle, you can remove one side of it. Let's try and do that. It's not letting me do it. Okay, now I've spoiled the whole thing. But the idea is to free up one side so that you can stick it on one side of the wound and then pull the wound together and stick the other side on too. Just the same as you do with a butterfly wound closure. But these things stick better and they are more waterproof. So I like them better than I do the butterfly closure. So that's the Steri-Strip.
So Peter, we had one question.
Yeah.
The names of the Band-Aids so far, just to review their names.
Okay. The first one I showed you, the colloid, is the HydroSeal Band-Aid. And I will say, this is not supposed to be an advertisement, but I have tried the same kind of bandage from other manufacturers, and they don't stick so well. So I have a bias towards Johnson & Johnson's product. This is a butterfly closure. You can see the picture right on the front. And this, the name that I know is Steri-Strip. And this is not, this is made, I don't know who makes this one, but I would look for Steri-Strips. I don't know who manufactures those, but they're good to have on board. Now, one other thing. So while we're talking about wounds, liquid bandage is a little tube or glass container. Here we go. So it's a little bottle which has a brush in it. And the idea here is that you can
Just hold it real still. There you go.
all right. So it's like, ladies, it's like putting on nail polish. You get a brush full of the paint and you paint it on either side of the wound and then on the middle. And what it will do is to seal everything up. It's really not a glue, but if you have a small laceration that isn't bleeding too much, and you don't want to bandage it for some reason, or even if you do, you can paint this on. That will probably stop the bleeding and seal the whole thing up. Then you can put a regular bandage on there without making it too bulky. Okay. All right. While we're on fingers, I am going to borrow Donna's finger. Right. Okay. So what we're going to do here is to demonstrate the use of tube gauze. So this funny donut thing that you're looking at is in fact rolled up gauze, rolled up in two directions. So if I pull it apart, hopefully you can see how this works. Okay, so it's donuts both rolled in opposite directions. So if I take Donna's finger, and let's suppose that she has a laceration here. She was preparing the beans for dinner and somehow sliced her finger a little bit. So you put a dressing on here first, small piece of gauze or something just to cover the wound. And then you can roll this gauze dressing over the top. And remember, I talked about applying a little bit of pressure. And this will apply a little bit of pressure to the wound and prevent too much bleeding. And then you twist this around, twist the other donut around. Once you've got to, you've unrolled one right the way down the whole finger. And this one goes in that way. Okay, so you got two layers of gauze and you've got a dressing underneath covering the laceration. And finally, you can finish off with a finger cut, which is rubber. This one is too big for her finger, but we'll use it anyway. Okay, and then if you're really being particular, you can trim off this end here so that you can roll the end of the finger cut right the way over the end of the gauze. Now, why go to all of that trouble? And here's the reason why. This is a nice flexible dressing. It applies a little pressure. It protects the damage. Wiggle your finger, Donna. Good. So you can't really retire a crew member when you're out there, and they will want to help and do things. So with some limitations, this is still a finger that can be used for light duty only. It won't get wet. The dressing's not going to get wet because it's got this plastic covering. It's not exposed to the air, so the bacteria can't get in. I just think that for finger injuries on board, this is a neat thing to use.
So I have a question, Peter. When you put that outer covering over, does that deny oxygen to the wound or does it matter?
It's not so much denying the oxygen, it's the bacteria that may be in the oxygen that you want to keep out. So the answer is, depending on what it looks like underneath, maybe a little bit of antibacterial ointment, a small sliver of a gauze square,
Okay, yeah.
and then slide everything on top of that,
Yeah.
and then leave it alone for 2 or 3 days. And if you can really sit on your hands and wait that long, you can take it off, and it's probably going to be pretty much healed up by that time.
Okay.
Okay, how does that feel?
Feels comfortable.
All right, do you feel any pressure?
No.
Not too much? Okay. All right. So since Donna is here, let's move on to the next demonstration. And this is the triangular bandage. Now, Maureen doesn't know that I have this. I hope she's not watching. But again, the MacGyver in you is thinking about what you do about this poor crew member who fell and hurt her shoulder, and she's in a lot of pain. So we have given her some acetaminophen or some ibuprofen to deal with the discomfort. But she says that every time she moves her shoulder, it really, really hurts. So we want to provide her with a sling. So it will relieve her of having to carry the weight of her arm on her shoulder. And the triangular bandage is the way to go. So take a square, any square, and double it over like that. Okay. And you have a triangular bandage. And you take the bandage, put it around your crew member's neck like that. And gently, gently put her shoulder in the bandage. There we go. And just let the bandage take the whole weight of your arm. That's it. So this is not a terribly good fit, but it'll work, especially for a soldier, for a shoulder injury. So if I were to leave this on her, I would tie a knot or use a pin at the back here. Actually, if it's Maureen's silk scarf, I would tie a knot because I can undo that. And to secure this piece at the front, I would either pin it or tape it, just to make sure that it doesn't come undone. And there you have a nice support for an injured arm. Use it for a shoulder. You can use it for an elbow. You can modify it if you want to. Excuse me. You can modify it. Something like that. Okay, so multiple uses, but for upper arm injuries can be very helpful. Thank you.
You're welcome. Nice silk.
Yeah, I got some explaining to do, I know. Okay, a couple of other things I want to show you. We talked about patients who are suffering from cold exposure, maybe fallen overboard, hypothermic, and the value of oil in keeping them warm. So this is a manufactured blanket. Grab that, Bill. Which is not behaving itself. So this is what the sort of commercial blanket looks like. And these things look and feel very flimsy. So you would wonder how on earth that could make any difference if you're pulling somebody in from being in the water for 10 minutes and you want to warm them up. But it's very effective. And this one is big enough to cover a large person and will be very beneficial to them in keeping them in keeping up their body, in fact, increasing their body heat. So that's the thermal blanket. That's in some of these first aid kits, not all. But if you don't have something like that on board, cooking foil, aluminum foil works perfectly well. So keep that in your mind. We haven't really talked about serious bleeding, but sometimes when you have a limb injury, particularly a leg injury, legs have big arteries in them, and you just can't stop the bleeding, and you may want to use a tourniquet. We touched on that very, very briefly. This kit comes with a tourniquet, which I'm not going to demonstrate this, which goes around the thigh, and you can tighten it up to whatever tightness you want, like that. And you want to tighten it up enough to stop the bleeding, but remember that if you stop the bleeding for too long, then the limb that is distal, that is on the other side of the tourniquet, could be damaged. So you have to let off the pressure about every 20 minutes or so, even though there may be some more bleeding. So that's a tourniquet. And if you don't have one of these, then a belt will work perfectly well. Okay. All right. So I think that that is all I'm going to demonstrate to you. Move on to the next section of the presentation. So we've been going for about an hour. All right. I think our timing is going to be pretty good. Oh, I did not show you one other thing. I'm sorry. That's okay. Yeah. Are they just seeing the slide?
They're seeing the slide.
Mostly the slide.
Okay, so let's get that off then.
You should be good.
So I wanted to show you a non-stick dressing. This is a good example. They sometimes look a little different. They sometimes look like they have some saran wrap on the front of them. But the idea here is that you can put these on a burn, an abrasion, or maybe even a laceration, and put a bandage around them, and they won't stick. They won't stick because of this shiny surface here, which is just covering the pores normally in the gauze, or that plastic sheet, the saran wrap sheet that you'll find on some similar products. I don't know whether you've ever been through this before, but if you're trying to get a bandage off an abrasion and clotting has occurred and it's become really closely attached to the wound, or you're trying to get it off a burn, it can be incredibly painful. So this kind of thing is really useful. Okay, non-stick bandage, and it goes with this stuff. Can I borrow you again, Donna? This is a self-adhesive bandage. Yeah, and it goes on like this. And I don't have scissors with me. The nice thing about this is that you can let go of it and it won't unravel. It's stuck to itself. The other nice thing about it is that it's a little bit elastic. So you can apply a little pressure when you're putting your bandage on. You don't have to worry about it coming unraveled. you can get to the top when you're ready to end, and just kind of leave it there while you go away and find a piece of tape to stick it down or a pair of scissors to cut it,
Can I show the?
Yeah.
The label?
please.
Sure.
All right, now get back to the slides. So I hope that was helpful. Now I'm going to talk about some of the things that we hope will never, ever happen to you, but which will require some preparation before the crew member is shipped out. So this is not advanced.
While you have a second, Peter.
Yeah.
A question from Mimi. It says, when you're talking about the foil wrap for the heat retention, does the silver side go against the body?
Yes.
Okay.
Should have been clear about that. Yes. The orange side on the outside. I'm not sure why.
I can do the other.
Whatever.
Madeline, you know why this PowerPoint wouldn't advance?
Ah,
Madeline, could you unmute?
I think you might have to have the pointer on this, on the PowerPoint. Is that,
The pointer?
oh, I see it. It is
oh,
on.
yes,
Yep,
got
we
it.
did it.
We got it.
Thank you, Madeline.
You're welcome.
Okay, so a reminder again, we are talking about coastal cruising. We're not talking about blue water. We are talking about a situation where you're 2 hours, maybe 3 at the most, from a major medical facility. And in that kind of situation, you are not going to be dealing with the emergency per se. And what I mean by that is that your main task will be to stabilize your crew member, make them as comfortable as possible, and then hightail it to the clearest hospital or radio the Coast Guard for help. So how would you define a serious or major medical problem? Most of that's based on what you know about what's happened to the crew member and what you find when you look at them. So the initial assessment is going to rest on whether there's a pulse or no pulse, whether there's heavy bleeding or no bleeding, whether your crew member is breathing or not breathing, or whether they're conscious or unconscious. And that'll be a really quick assessment. You'll under 5 seconds will give you that kind of information most of the time. Pulse versus no pulse, the best pulse to try to feel is the carotid pulse, which is just under the angle of the jaw. If you put your fingers there, you can feel it. Don't press too hard because you may faint. But that's where the carotid pulse is. And that should give you that information. Heavy breathing speaks for itself. Breathing, you should be able to see breathing movements, but if the breathing is minimal, it may be quite difficult to tell. So you might want to listen carefully over the nose. Conscious versus unconscious sort of speaks for itself. And the possible diagnoses we're talking about here are, say, a stroke versus a heart attack, hypothermia, which may be just extreme cooling alone, or it may be in conjunction with a fractured limb, or maybe a head injury and unconsciousness. So that may be quite a complicated situation to deal with. Compound fracture by definition is a fracture where the broken bones are sticking through the skin. Yes, not a nice thought, but it happens. And major burns is not a character from MASH. Major burns in this case is either extensive 3rd or 4th degree burns. And I think I've emphasized before how much of an emergency that is. So what are you going to do while you're waiting for help to arrive, or while you're on your way to the nearest medical facility? You're going to make sure that you know your first aid and you've done the CPR class, because you may need to use all of those skills. Make a quick assessment and write it down just so that you don't get too flustered, and then make your Mayday call on your VHF. And through your mind, the following questions will be going. Are we in a safe place for the victim and the rescuer? So if you're anchored in a bay and the water is fine, is nice and calm, no problem. If you're in a big seaway, that's going to be really tricky. So that kind of information will be very valuable to the Coast Guard. Was there a spinal injury? And if there was a spinal injury, do you need to stabilize the neck? And the answer is yes. So go back to what we talked about, those rolled up towels, and making sure that your crew member is lying flat on a firm surface and that their neck is not allowed to move. So if you have someone else on board, station them near your crew member's head and get them to make sure that it stays exactly the same position. Quick medical history, you should know that already, but try to get some information if you can. Obviously, if the patient's unconscious, they're not going to be telling you anything, but somebody else on board may know something about their previous health history. Avoid contact with blood and body fluids. That is really difficult, folks, but if you can, do it. But the most important thing really is to take care of the injured person and do the right thing by them. If the person's conscious, ask permission to help. You should do that, but honestly, in the heat of the moment, you're probably not going to ask that question. And certainly if they're unconscious, then consent is implied. The basics of CPR, these are recommendations from the American Heart Association, and I've spoken about this a little bit at the beginning of the presentation. If you are really up to date with your CPR, if you really feel comfortable and competent, then go for the full court press. If you feel a little rusty or you haven't done a course at all, then just rely on chest compressions. And the chest compression should be about 100 to 120 a minute. And you'll see in the pink inlet that if you hum the Bee Gees Staying Alive to yourself, how appropriate is that? It gives you the right kind of rhythm for the compressions. And the compressions need to be about 2 inches in depth. So, you're not going to be too soft, but you shouldn't be pushing so hard that you break ribs. About 2 inches is about right. And what that does is to first of all help the heart to pump blood, but also it moves the lungs enough that they may be drawing in enough oxygen to keep your injured member going. So CPR. So if you're dealing with an unconscious patient, then assess them for breathing and pulse, and if they are breathing, put them in a nice warm flat place, especially if you have pulled them out of the ocean. Put one of those blankets on them, try to keep their head warm as well, but don't give them too much stimulation. We'll talk about that in a bit more later. But if they're unconscious, just keep them still and warm and just monitor them carefully. And if you have to, use CPR when when either breathing stops or you have no pulse. If they're conscious, then obviously you're going to have a little bit more cooperation. Warm and comfortable is still advisable, and constant monitoring is still advisable, even though they may be awake and alert and cooperating. Don't give them anything to eat or drink, because they may end up going to a hospital and require an anesthetic. So that is not advised. And again, they say signal on the boat. I'm not quite sure what that means, but make sure the insurance information is ready, ID, glasses, and so on. So anything that the hospital is likely to need to provide your crew member with care, including glasses, because if they can't see what they're doing, it can be very disorienting. So airway obstruction. If somebody has taken a big bite out of a beef sandwich and suddenly appears to be choking and they can't talk and they're having difficulty breathing, and maybe it's noisy, wheezy, or squeaky breathing. Maybe they're trying to cough and cough something up, but they can't. Their skin, lips and nails may be turning blue because the blood isn't moving around, and it's not moving through the lungs. It's not getting oxygenated, so the fingers may look blue. And they talk about skin that is flushed and turns pale or bluish in color. I'm not quite sure where they get that from, but this is obviously a pretty serious situation, and your crew members having trouble breathing, and this may, if it goes on, lead to loss of consciousness and conceivably even death. So if they can cough forcefully, they should be encouraged to do so. They may be able to cough up whatever the obstruction is. If they're choking and can't talk, then you need to administer the Heimlich maneuver, which is a maneuver in which you stand behind the patient. I'm not going to demonstrate this on Donna. And you put your hands over the bottom of the rib cage and forcefully squeeze rapidly. And that may be enough to produce pressure in the lungs, and the ham sandwich or whatever it is will pop out. I would get some diagrams. I should have brought one with me, but get a diagram of how to do the Heimlich and just keep it in your library on board just in case. Chest pain. Typical heart attack symptoms are pain in the chest, feels like an elephant sitting on your chest, typically radiating down the left arm, sometimes up into the jaw, depending on the location of the damaged heart muscle itself, shortness of breath, anxiety, because it's very painful and the crew member is wondering what the heck's going on, and sometimes nausea or vomiting. Now that's typical. We are of a generation where we may not present with the typical symptoms, particularly this is true of women. So anything that looks a little bit like it could be a heart attack, be suspicious, even if the typical symptoms are not there. What could it be confused with? Well, it could be confused with indigestion or heartburn, in which case an antacid would be worth trying to see whether that helps with the pain. It could be a pulmonary embolus, which is a blood clot in the lung, which could be another big problem. Could be an aneurysm, number of things that it could be, but all of them should be treated in pretty much the same way that you would if you're dealing with a heart attack. In other words, stabilize, make your patient comfortable, and get them for professional help as quickly as you possibly can. They say here, give the patient an aspirin, and I suppose that's a good idea. But you have to be able to distinguish very exactly between this being a cardiac or a pulmonary event and a stroke. The idea of giving an aspirin is that it's a blood thinner. So if a blood clot is causing a blockage in a coronary artery and creating the heart attack, an aspirin might help. But if it's the middle cerebral artery that's bleeding in the head, it's going to make that situation much worse. So if you are sure this is cardiac, then an aspirin might be a good idea. If you're not sure, don't do it. Here you go. A stroke is, believe it or not, at least as much, if not more, of an emergency than a heart attack, because the extent of damage to the brain is going to be determined by the amount of time it takes before they get into the lab for a cerebral arteriogram or maybe even surgery to remove the blood clot or clip off the bleeding. Okay. Seizure. Here, I think the most important thing is to make sure the patient's on their side so they don't, if they do vomit, they don't inhale their own vomit, and try to prevent them from damaging themselves by the muscular thrashing around that is part of the seizure. And usually that will calm down after a period of time. Your patient's going to seem very, very groggy because they do after having a seizure. But if you just are patient and wait long enough, usually they're fine. If they keep seizing and you can't stop it, or it doesn't seem to be stopping, again, hospital, quick. Anaphylaxis. So we talked about EpiPens. This description here describes what happens in someone who is having an attack of allergic attack that will affect the airway and breathing. So I think we've really discussed that already. And the cure for this, if this is happening to anybody on board, is the EpiPen. And the EpiPen should be curative. But just be aware of the fact that if you're injecting anybody with epinephrine, it does the job beautifully, but your patient is very uncomfortable because they feel agitated, jazzed. You know, it's like having 10 cups of super strong coffee and not a comfortable feeling at all, but they'll be much relieved as their angioedema goes down. And I think we've just been through that. How are we doing on time now? Okay. Hypothermia, real quick. Hypothermia, especially cold water immersion, is an emergency under any circumstances. It is not a mild thing that can be dealt with by just pulling the individual out of the water, warming them up and waiting for them to recover. You might do that if they've been in the water 5 minutes or less, but anything longer than that is going to cool them off to the extent that they need professional care. So your duty on board is to try to get them as comfortable as possible. Don't stimulate them too much because they're in a hyper excitable state since they thought they were going to die. And the sudden exposure to cold water will set off all kinds of responses in their nervous system. If you stimulate them any further, you may actually precipitate a cardiac arrest or a cardiac arrhythmia. So gently is the watchword. Move them out of the cold, get him into a safe spot on the boat somewhere, remove wet clothing, use the thermal blanket. If you don't have that, use ordinary blankets. There's no need to use a heated blanket. There's no need to use any heated compresses. Just cover up, keep them as warm as you can, and wait patiently for body temperature to come up. They say here, offer them warm, sweet, non-alcoholic, non-caffeinated drinks, and that would be okay. If they go into cardiac arrest, then you start CPR. But this is an emergency and you need to get them into professional care. So you may have to call the Coast Guard and say, hey, look, we just pulled somebody out of the water. They were in the water for about 10, 15 minutes. You won't have a thermometer on board, but you can describe the symptoms and they will direct you to the nearest place, or they may send a boat out to collect the individual who fell overboard. Don't treat it lightly. That's the message. Fractures, call for emergency if there's a fracture with heavy bleeding. If there is heavy bleeding, get the biggest, most absorbent bandage you can, stick it right in the wound, press on it, wrap a firm bandage around it, try to staunch the bleeding. If you can't stop it, use a tourniquet, but be careful about leaving it on too long. But this is a person who needs to get to the hospital quick, and just a clinic ain't gonna do it. You really, this kind of a fracture is going to end up in the operating room. Okay. I can't read the title on this one.
For bleeding from any cause?
Okay. Okay, severe bleeding. Remove clothing, debris, and try to expose the area that is bleeding as best you can. If it still continues to bleed profusely, then your task is just to use as much bandaging as you can to staunch the bleeding and just head for a hospital. If there's something stuck in the wound, don't take it out, because it may be plugging a hole, which if you remove it, will start bleeding much more briskly. So if there's a foreign object sticking in the wound, leave it there. Just pressure, lots of absorbent bandaging, and try to stop the bleeding if you can. Okay, and I think the rest of that is sort of self-explanatory. Oh, should have mentioned, if they are lying down and a leg is bleeding from a big laceration or a compound fracture that's broken through an artery, try to elevate that limb a little bit. That may reduce the blood pressure in that limb and lessen the bleeding somewhat. So you want them lying down if you can. Just keep up the pressure on the bandage, use the tourniquet, we talked about that, and don't let them move around too much. Really, you need to call for help, and you probably need either an ambulance waiting for you at the dock, or you need this individual to be evacuated by the Coast Guard. Burns, we talked about a little bit. Minor burns. Major burns, again, stabilize the patient, get him lying flat, cover the burned areas. If there's clothing or other material actually on the burns, you can try to remove that. It's probably going to be extremely painful, so don't struggle too hard. But the main treatment here is to cover the burned area, keep it moist, keep the air out of it, and elevate that. If it's a limb, elevate the limb if you can, just a little bit above the horizontal. You don't need to put it high in the air, but just a little bit above horizontal, and go for help.
Keeping it moist, Peter, is that even a spray bottle of water kind of thing, or just?
I wouldn't use water. I would use, if you have it, the aloe gel or even hand cream, just to make sure it doesn't get too dry, but cover it up. Water itself, they don't recommend, because when it evaporates, it draws heat out of the body.
Right.
So I think the aloe gel is probably the best thing. You probably won't have enough of the nonstick gauzes on board to handle a large burn. But get this patient to a hospital, and they need to be in a specialized burn unit. All right, carbon monoxide. Early symptoms. Let's move on. Am I running out of time? Carbon monoxide, sometimes been called the silent killer. I think in a previous presentation, I described carbon monoxide as heavier than air, and it isn't. It is slightly lighter than air. But its presence is very dangerous, and that's why I don't think it's a requirement, but we're advised to have carbon monoxide detectors on board. And if you don't have one, please get one, because if you're sleeping and carbon monoxide is accumulating in the boat, you may never wake up, because you'll be breathing it in, and because you're asleep, you won't know. If you were awake, you might develop some of the symptoms that you see right there. And the treatment is pretty straightforward up to a point. Of course, get them away from the source of carbon monoxide if you know what it is. Open the windows and hatches and get a good flow of air going through. Turn off the engine, because it may be engine fumes that are doing this. You may need to use CPR. You will need to call for help. This is not a benign situation, even though your patient appears to be doing well. What's happened is that the carbon monoxide has latched onto the red cells, and it sticks to the red cells more readily than oxygen does. So while it's there, it's blocking the absorption of oxygen from the lungs and the circulation around the body. And the best way to counter that is to put the patient in a hyperbaric oxygen chamber, which forces the oxygen into the bloodstream. So this is never a benign situation. And if you ever come across anyone on board suffering from these symptoms, do the first aid things by all means, but call for help, and this patient needs to be in a specialized unit. Finally, good preparation will almost always help you to deal with any first aid situation on board. Don't panic, use common sense, use what's available on board, even if it's not in your first aid kit. There are other things that you can use. Get help, use your VHF, and make sure that you know before you leave the dock at your own slip, you know where the nearest medical facility is, just in case, just in case. But we're going to continue doing what we're doing. We love going down to the sea in ships. And here is my epilogue. This is the poem Sea Fever by John Masefield. Just a beautiful anthem towards the thing that we love. Thank you very much for listening. Appreciate it. Do we have time for questions?
Yes, yeah, absolutely. You can type them in if it's easier, or unmute and speak them, either way.
I'd just like to thank you, Peter, for doing this.
Well,
Every time I hear you, I learn something important. So thank you very much.
I hope it was helpful to everybody. That's really the point. Stay safe.
A few more people.
Well, everyone, you have my email address. Please, if you have questions, don't be afraid. I'll be happy to respond if I can.
Thank you very much. That was great.
Good to see everybody. Thank you for taking the extra time to come.
Yeah, thank you guys. It was good class. Always good to learn stuff, especially safety.
Do you want to say anything, Graham, about